Welcome to All Things Cardio-Oncology. My name is Steve Caselli. I'm the Executive Director of ICOS. And in this podcast, you'll hear from a diverse representation from our community. We want you to be both informed and inspired by their stories and experiences, and we're so glad that you've joined us today. Well, we have a number of guests with us today, including my traditional co-hosts, Dr. Arjun Ghosh in London and Dan Lenehan in Cape Girardeau, just south of St. Louis. So welcome to them. And because we have a number of people presenting today, I'm going to have them introduce themselves as they speak. But Dan, tell us a little bit about what we're in for today.
Well, thanks, Steve. I think, we're very excited to learn about the different educational developments that have been happening in certain places in the world, and these experts that are on the call today are really leading the way. So we're hopefully going to hear about what type of educational efforts they've been into, and this includes not only in the UK but in Spain and in Brazil. So we're very excited to understand how these innovative programs have got started. So I think I guess the question is who wants to go first? Since I just ended up saying something to Renato, maybe Renato, you can tell us what's going on in Brazil.
Sure, Dan. Thanks, everyone. Excited to be here with the team. And we're going to give a quick overview of why we created really this course in cardio-oncology in Brazil, and then Carolina is going to give us a little bit on what are the details of the course. So as everybody knows, cardio-oncology is a growing field all over the world, including Brazil. And there was really no organized and academic course focused on science and what's the best in terms of scientific aspects of cardio-oncology going on. At the same time, Carolina and Ariane and I were working on other things together, and both of them had the largest experience in the field, working with cardio-oncology for over 10 years. So really well positioned to lead this effort. So in addition to that, we happen to lead the Brazilian Clinical Research Institute, which is an academic research organization with a long time track record in research and education, and the first ARO in Brazil, affiliated to Duke. So we brainstorming and take advantage of everybody's expertise. We felt that we had really the opportunity to create a unique course, a course that would be recognized by the Ministry of Education, which ended up being so. And we talk about creating the perfect course, or what we believe could be the perfect course based on our expertise and our beliefs. Of course, in using all infrastructure that we had in place with the BCRI and the expertise that Ariane, Carolina, and I had in different fields. So we created the course. We selected initially 32 students who are highly qualified students, I must say, to really create this unique program that goes really above and beyond only cardio-oncology. We took the advantage to try to innovate with some modules that we believe would be the best for the whole course as a whole, including topics such as soft skills and also clinical research, and a really strong detailed course in cardio-oncology. But maybe Carolina can give you all what we mean by a really comprehensive and detailed course in cardio-oncology that we believe will make physicians well prepared to face these patients in clinical practice.
Hi, everyone. Thanks for having me here. It's really an honor to talk about our program. So I was lucky to be the director of the University of São Paulo Cardio-Oncology Fellowship Program for 4 years, and it is the biggest university in Brazil. And I was happy but sad because we could teach a lot about clinical practice, but very little about oncology, hematology, and the how can I say, the theoretical aspects. So when I left University of São Paulo, I was lucky again to meet Renato and Ariane and to build this program. So we tried to give a very strong theoretical basis, but also aligned with clinical expertise. So our program is divided into 4 main blocks. The first block is basics of oncology and chemotherapy, radiotherapy, and all this stuff related to oncological team. And this is taught mainly by oncologists. Then the second part of the course is a deep dive in different tumors and the cardiovascular aspects related to these tumors. And this is the biggest part of the course. It's very tough. And basically, we follow always the same scheme. First, a oncologist to talk about the oncological aspects and definitions of the tumors. And then the same oncologist talks about treatment, how we manage these patients. And then a cardiologist come to talk about the cardiovascular issues related to treatment. And we repeated this scheme in each, and all the tumors had the same scheme of teaching. And this was one of the strong, what we did best in the program, because I believe that it's very straightforward to the student when you have this integrated view. And this was I believe, a very nice decision from our part. It worked really, really nice. And by the way, we followed the paper published by Dan in JACC-EO talking about how to build a strong cardio-oncology program, so that endless list of all tumors that we had that used that to teach, that was our Bible, I would say. So we were very driven by that paper. Then we had the clinical research block. So Renato, needless to say, his expertise in clinical research and the BCRI team was very important for us to teach a little of clinical research, so students could really learn how to read and how to understand the clinical research and the papers and all the literature in cardio-oncology. And then least but not least, my favorite part of the course is the soft skills block, where we talked to our students about communication, storytelling, innovation, healthcare, and we brought a lot of non-medical speakers, and it was so amazing and so incredible to talk about different stuff, and it was very well received, and we were really happy to have this experience. So that's it, and I'm absolutely sure that we learned much more than the students, and this is what is very fascinating, and it's our passion to teach, and it was a really joy, and happier than ever to talk to you about all this.
That's really amazing. And I think, certainly in my own experiences, I would say if you understand something well enough to teach it, that you know it just so much better than maybe the first time or first few times that you're exposed to it. Arjun and Mark, what kind of things happened in the UK, or how did you see this challenge of educating our future cardio-oncologists?
Obviously, within cardiology, we have a core and advanced specialty program. Within the core program, we have sort of 5 core, what we call capabilities. We've moved over from a competency-based to a capability-based framework. And so one of the 5 capabilities is heart failure, and cardio-oncology sits within that. But it does have a specific comment in there about exposure to cardio-oncology for everybody who's training as a cardiologist in the United Kingdom. Then all cardiologists would subspecialize in one of the main 5 themes for service, as they're called, or we might call them subspecialties. One of those 5 is heart failure. And again, cardio-oncology sits in there with quite a lot of flexibility, actually, that we managed to work in. So whilst we might think that heart failure involves sort of classic heart failure clinics, there's a definite comment about cardio-oncology, and actually being able in your final 2 years to spend a significant component of those final 2 years actually doing cardio-oncology as a subspecialty based on local patient demographics, local expertise, etc. I guess after that, we're then moving into bespoke programs, and the way that training's going here would be post-CCT credentialing. So CCT is what you get to be what we call a consultant, or you might call it an attending in the US. They have different names in different countries. But you would probably want a period over and above and beyond what's offered in cardiology training to be a true expert in cardio-oncology. Those programs at the moment are all locally run. There are not that many in the UK, although they're expanding. The one we have is we would have 1 or 2 fellows attached to the cardio-oncology service. So that's 2 outpatient clinics a week, one of about 15 to 20 patients, the other of up to 30 outpatients. Obviously, we wouldn't see everything, but they'll get a good range of the various common problems and diagnoses, etc., that we see on cardio-oncology. Then got our weekly multi-professional meeting where we discuss the more complicated cases out of those. Then we've got the ward work on top. So we have at least twice weekly cardio-oncology ward rounds, plus all the referrals, etc. We've got a large oncology service on site. So we cover them. So they tend to, now they know we exist and that we're helpful and friendly, ask us quite frequently for opinions, which is exactly what we want. We want to be there to work as a team with our colleagues. And that's really evolved over the last, I would say 5 years, or probably slightly longer. People who come and do periods with us, it really depends on their prior experience. But I think we would always say, if you really want to get something out of being part of our team and working with us, you want a minimum of 6 months. And people have, by and large, done that. And a lot of people have stayed a bit longer. They've actually enjoyed things, learned a lot, and they've decided that they want to continue to learn with us for a little bit longer before they go off wherever it may be, either within the United Kingdom to think about setting up their own local service, or to move farther afield. So I guess our specialty program, if you want to call it that, in cardio-oncology locally is perhaps a little bit ad hoc and maybe a little informal, certainly nothing like the formality and structure of the program that we've just heard about, which sounds truly phenomenal. And my hat off to my colleagues in Brazil. But I think we have a system that works for the way our training works in the UK, and certainly seems very popular. I've probably said way too much, but I'll see if Arjun's got anything to add.
Yeah, thanks, Mark. I think you've explained it very well. I'd probably just add that there's also a fairly strong research component to it as well. So we have a number of trainees who come to us wanting to do research. So there's clinical research for cardio-oncology trainees. We've also got basic science research for cardio-oncology trainees. And that is something they do when they take some time out of their normal training program and then do the research and then come back into clinical training. And alongside that, the fellowships that Mark was talking about at Bart's Heart Center and at UCLH, they're international as well. So we've had people from Mexico, from Australia, from Spain, Portugal come and join us for, anywhere from 3 months to over a year. And then, as Mark said, going back to set up services in their own home institutions or their own home countries, which I think is a fantastic way to kind of bring international collaboration, which is, one of the cornerstones, of course, of ICOS as well.
If you or your institution would like to have credentials that confirm your qualifications as a cardio-oncologist or a cardio-oncology center of excellence, we encourage you to consider applying for our certification exam in cardio-oncology or our certification for centers of excellence. These are the only certifications currently available in this field, and it's a special opportunity for you or your institution to distinguish yourself, recognizing your expertise in the field. More information about both these opportunities can be found at ic-os.org, or you can email directoricos@gmail.com for more information.
Yeah, I think the one, it's really interesting to hear what has developed in in Brazil and in the UK. When you contrast that with the United States, for example, one of our biggest efforts was to try to integrate cardio-oncology into the cardiology fellowship. So get earlier and earlier in fellowship as a major rotation, or have longitudinal clinics throughout their fellowship that are based in cardio-oncology. So that's certainly one way to get at it in terms of advanced training. But the key difference that at least that I heard from Brazil was that in Brazil, it wasn't necessarily a person coming to a major center and staying there for 6 months or a year or however long, where they would get a very focused training, but rather it was integrated into their daily lives. And that, I think, is a really huge barrier that we have to figure out. If we want to advance cardio-oncology training for people that are not in fellowship, we're going to have to think about that. How can we integrate it into their sort of daily life? Take a bit of their daily life and put that into cardio-oncology training, and perhaps over a longer period of time. So Teresa from Madrid, I know you've really developed what sounds like a beautiful master's program. And I know it has reached out to many places in South America, as I understand it. But so how do things look on your end?
Thank you, Dan. I'm really happy to be here. As you know, I work in Madrid, in Spain, and our first goal when we created the Spanish Cardio-Oncology chapter was to focus on education. And for that purpose, we create an agreement with all our national oncology societies to try to promote first the field of cardio-oncology. And for that purpose, we organized different online courses through the website of local societies. But 4 years ago, we started to work with University Francisco de Vitoria. And we organized during 2 years a large course on cardio-oncology. That is not really a master. And this course was attended by at least 100 students per year. And because we really detect a great interest in the field, not just focus on how to manage or how to prevent cardiovascular toxicity, but also on how to really understand the work of oncologists and hematologists with their patients. 2 years ago, we started with this master degree. And as Carolina told us, we also include in this educational program different skills that started with basis in oncology and hematology, some chapters that are focused on cancer therapies, on basic and translational research, and of course we also moved to the cardiology part of cardio-oncology, and we have specific modules that focus on prevention and management of the different cardiovascular toxicity. But probably what is missing in our program, and I think that this is a really good idea that the Brazilian team brings to the cardio-oncology scenario, is to also include soft and communication skills in all these programs, because we really need to learn how to work in multidisciplinary team, and this is not easy to do, because we need to understand how to really integrate the knowledge of different specialties in our daily practice. And I think that this is a really amazing initiative. In our experience, probably one of the the strongest things that we have created in our master is a very dynamic forum where we interact with students every day, and we present them different clinical cases, and we discuss articles. We ask them to present their own clinical cases or their daily question or what they want to learn from the experts that are part of the teachers team, and we organize every 3-4 weeks an interactive webinar with all the students to try to update all the questions and all the clinical cases that are presented in the forum. So in that way, this is not just an online learning experience, but a really dynamic forum to learn cardio-oncology. And as Renato and Carolina told before, we learn a lot when we teach, and we are able to integrate the cardio-oncology experience not just from people that work in Spain, but also from people that work in South America. And this is amazing to really understand what are the challenges and the different opportunities that we have across the world to work in that field.
Wow, that's really, really tremendous. And I think in order to make it a rich experience, I think the interactive part is what really solidifies people's training or understanding. So Renato, you explained some of the details about your program. What kind of challenges do you see, or what sort of opportunity has arisen because of what you've already developed? Where do you see things going?
Sure. So I'll focus more in the opportunity here, Dan, and let the challenges to Ariane.
That's a good plan.
Good plan.
Yeah.
The opportunity that I see here when we did this course is definitely, as you all are very aware, if you look at the recent European Society of Cardiology guidelines, 95% or plus of the recommendations are level of that evidence C, which means that we desperately need high quality evidence to guide our clinical practice in this area, in this therapeutic area. I know that even in general in cardiology, when we publish in JAMA demonstrating that only 8.5% of overall cardiology recommendations are based or classified as level of evidence A, in cardio-oncology, this number is way, way below that. And I think, in one hand, this is a challenge. On the other hand, is a blue ocean in terms of opportunities that we have to create the right community, the right collaboration, the right players, to design the right studies, and starting having high quality evidence to really guide what we do in clinical practice. And we try to do that. So a lot of these students, actually every student had to have a research project at the end of the course to present to us. And some of them are actually gonna become true projects that we're gonna raise funding, and we're gonna try to actually develop the clinical trial or a clinical registry. The students are all over the country, so this automatically make the project national. They are in high volume centers, and we believe that this is a really nice opportunity to bring these ex-students now with already a formal training in cardio-oncology to now develop this project with us, or these projects with us, in addition to really making the topic aware to everyone that want to study cardio-oncology. Or we have an idea, we try to match a sponsor, we have all the infrastructure of the ARO to make it happen in high standards. And we believe then with this, maybe in 2, 3, 4 years, we're going to start having more high quality evidence coming from Brazil. We are already doing this in other fields in cardiology, so hopefully this will happen in cardio-oncology. And through venues like this one, like ICOs and individuals that we work with, like Teresa and others all over the world, make those projects not just national in Brazil, but international. And with that, start building a new culture that we can, as a team, we can, in a collaborative fashion, develop good projects, good research projects that can change the way we treat these patients based on more than just guessing, but based on high quality evidence. So to me, that's a major opportunity that we identify with the students, and we are currently implementing as we speak. But maybe Ariane can talk about a little bit about the challenges that we believe that's going to be key for keeping the strength of the program going forward.
Hello, I'm Ariane from Brazil. I'm a cardiologist and cardio-oncologist. I feel that a lot of was already said about the program and so on, but I feel that the biggest challenge that not only in cardio-oncology, but in education in this century, and probably in the very long future, is how to engage people, to keep their attention, and to have more people knowing about cardio-oncology, interested, and not only cardiologists. I feel that the general doctor and even the oncologist. So I feel that now we need to keep on track. We need to keep this course. We had already, for this new group, more 30 students that were engaged. So we want to have and to keep the high quality of result that we got. We are following the same track, trying to give them not only the theory, but also the practical point of view. We have a group, we have a forum to discussion by WhatsApp. That's something that is very common in Brazil, to have WhatsApp groups. So Carolina and I, we are available 24/7 to discuss the clinical cases, to share our knowledge, and then even to help them with difficult cases based on our practice. So I feel that we now have a strong group that we want to grow. So the challenge that's it's how to communicate, how to engage these people, and to keep them interested and asking questions about cardio-oncology. That's what we want. When you have this group together, integrated with a very good communication, I feel that our field will continue to grow, as all here have been doing for the last more than 10 years. So we achieved a lot, but
do you guys ever sleep? Do you guys ever sleep? Or do you clue them in to say, maybe after 9 p.m. or something, don't be sending.
There is no time to ask questions.
No time? Oh, yeah.
As a matter of fact, then this WhatsApp group, which I'm involved as well, is really busy. People keep asking questions and posting articles, all kinds of questions that sometimes goes above and beyond cardio-oncology. So it's really a popular way to keep connected with the students. I know in the US we don't use that much, but in Europe and in South America for sure it's highly popular, and it's not only a nice way to keep everybody engaged, but to keep us connected with the students in all aspects of the course. As a matter of fact, we're trying to now finish the WhatsApp group because they already graduated, and they will not allow us to close the group.
Yeah. Can't give up yet, right?
Yeah.
So, Mark, what kind of things do you see going forward? I know that as we talked, you're kind of overseeing all of cardiology training in the UK, as I understand it, and that's a pretty big task. So, where do you see this going?
Yeah, thanks. And I wanted to pick up on a couple of points that Renato's made, because I think they're actually quite interesting and poignant. The one about the sort of relative lack of an evidence, base in cardio-oncology, I don't see as a challenge in many ways. I see it as an opportunity. I'm probably a little older than I look. I know you can't see me, but I actually remember when the treatment for heart failure was digoxin. In fact, ACE inhibitors, literally the first study was just coming out that they actually had some benefit.
So Mark, I will say that, in medical school, it was very clearly stated in multiple places, don't give beta blockers to people with heart failure. So
I remember those days. I remember it.
So, thankfully things have improved.
Yeah, and similarly in cardiac MRI, which is my other clinical area of expertise, there was no evidence base 20 years ago. There was no indication. So things can change pretty rapidly. And I actually say to people that actually coming into a field early like that is, you might feel, oh, well, I'm not sure what I'm doing. There's not a lot of evidence to guide me, but that's actually a fantastic opportunity because you have the opportunity to shape the entire field going forward, and you can have a fantastic career out of that, doing something that's well established and developed and is all embedded in very, very highly evidence-based protocols. You don't have that same opportunity. The second thing that I'd say as well is going back to your point, Dan, about trying to get people exposed early. We certainly know we've got a lot of evidence in the United Kingdom in cardiology training that the earlier you expose somebody on their cardiology career to a particular area, subspecialty, etc., the more likely they are to find it interesting and say, oh, I fancy doing that more long term, and spending a period of focused training, if you like, or subspecialization. And that was really my drive to get cardio-oncology into the early part of the cardiology curriculum. So the core bit, the bit that everybody has to do the same, supported with colleagues such as Chris Plummer. So there were quite a few proponents and advocates of cardio-oncology when we did our rewrite, which has just started this year. And I'm really hoping that does deliver, as it has with every other area of cardiology and subspecialty, that when we've put it earlier into the curriculum, you have a 3 to 5 year lag to see the rewards of that, but we will get people who then want to go and do higher degrees in specific areas of cardio-oncology, and also will want to do high level clinical training and then go on, set up units, etc. So absolutely, it's completely the reason we got it into the curriculum early, is to try and demonstrate the breadth of the subspecialty, the kind of things you can do that is very interesting, and hopefully entice our future generations of cardiologists to subspecialize.
Super. Arjun, what's your take on all of this?
Yeah, I mean, I think I agree. If there's a challenge, I think the best way to look at it is probably as an opportunity. And as Mark suggested, one of the things that happened a few years ago was that the overall medical body in the UK, the General Medical Council, suggested changing some of the curricula for the different specialties, including cardiology. And they wanted to condense things. But even within that, I think Mark and others found that to be an opportunity to actually get cardio-oncology formally into the curriculum, which then allowed, trainees to be exposed to it at an early stage. And what we see in practice is, we've in our program had cardio-oncology research fellows for a number of years, 6-7 years. And initially, when they spoke to fellow trainees and said, we're doing research in cardio-oncology, other trainees would ask them, what is that? What are you doing? What is cardio-oncology? But now we actually have lots of trainees coming to us saying, can you tell me more about cardio-oncology research? What are the different projects? This is something I'm interested in. And I think, establishing it in the curriculum, getting, episodes like, these podcasts, educational activities has really helped to make that mindset change amongst trainees.
Super. And Teresa, I know you have lots of perspectives of what's happening, but I think probably the most astonishing thing about your program in my book is how much it expanded, like seemingly suddenly. You had this idea, you kind of built it at a certain level, and then all of a sudden, boom, it's like going to many other countries. So what sort of things what challenges do you see in your immediate future?
Yeah, I think that probably the main challenges came from the differences in different health systems. So the access is to excellent medicine is not the same in all the countries and across all the countries. And this is also an area where we need to work about disparities in cancer treatment and disparities in the access to cardio-oncology clinic or cardio-oncology programs. But of course, we just need to increase the education of the oncologists and hematologists and cardiologists to really try to minimize these disparities, because if we are able to convince all the professionals on the value of this cardio-oncology practice, I'm sure that they are going to succeed to create their own program. And regarding research, which is critical for improvement in this field, probably the main challenge is to really connect internationally all the groups that are working in research in cardio-oncology, because we really need to get high numbers of patients in short time to increase the evidence. And for that purpose, the International Cardio-Oncology Society has created a new initiative in the next KICOS 2023 meeting, which is to organize a symposium that is focused on basic and translational research. And we are trying to create this platform as a meeting point for all the groups across the world that are working in research in cardio-oncology. So if we really are able to create this networking through the International Cardio-Oncology Society, I'm sure that research in cardio-oncology is going to improve, and that we are going to be able to really create a different research program that covers the evidence that we now are missing in some areas.
Super. Yeah. Well, and then certainly you have many innovative ideas, but I feel compelled to announce one that's in process. But so, in honor of the World Cup, which is going on right now, of course, we're developing a Champions League for cardio-oncology. And so we'll want people to sign up as a team, and they will answer questions over the spring before the GCOS meeting. Ultimately, we know that most people that we work with are fairly competitive, so we know that there'll be a lot of interest in that. But also, I think it's really to increase the trainee energy around the world, and this is one way that we thought we might be able to do it. So it's Teresa's original idea, so all credit needs to go to her, but I think we'll see if we can pull this off. I think we will, but nonetheless, look to that and start thinking about who's going to be on your team. So we all can't get Neymar or Messi. They probably wouldn't help us much on these questions, but so think about that, and we'll look forward to really, all of your programs that you're describing are truly fantastic. I'm super excited to hear about developments as you guys have, moved on in your programs. And, we are trying to develop some sort of international based program that hopefully will have, a significant announcement in the next few months. But thank you all so much. Steve, do you want to summarize what's gone on here?
I'll just say thank you to everybody. The work you're doing is incredible. One testament to the quality of, Renato mentioned the quality of the students you're getting engaged in your program. A number of them actually took our certification exam after they finished your course, and they all just performed really at a very high level. They did very, very well. So that was a real testament to the quality of the training that they're getting. So thank you. And these are just another way that we're trying to integrate with our colleagues around the world. And it's super exciting to see what the future holds in this area. So thank you all for taking the time to share with us the great work you're doing. For more information about ICOS, you can go to ic-os.org, where you'll find more information about all of our programs, including our weekly webinars, our board certification exam, and other resources that we know you'll find helpful. Thanks for joining us today, and we hope to hear from you soon.